Good day, ma'am. I am Chris Madatayo, your nursing aide for today. And today I will going to demonstrate obtaining capillary blood glucose specimen. For assessment, before obtaining capillary blood glucose specimen, we need to determine the policy and procedure for the facility and the frequency and type of testing, the client's understanding towards the procedure, the client's response to previous testing, and we need to assess the client's skin at the puncture site to determine if it is intact and the circulation is not compromised. Then check the color, warm, and capillary refill. Next, we need to review the client's medical record for the medications that may increase the bleeding response. And next, we need to assess the client's self-care ability that may cause the accuracy, the effect of accuracy result, such as visual impairment and finger dexterity. Then next, for planning, we need to review the type and the manufacturer's instructions, then gather all materials needed at the bedside, and afterwards introduce self and verify the client's identity according to agency's protocol. And next, explain to the client what you are going to do and why it is necessary, and how she or he can cooperate to the procedure. Then discuss how the result will use in planning further treatments. Then next, we need to perform hand hygiene and observe the appropriate infection prevention procedures. Then after performing hand hygiene, we need to provide privacy to the patient by closing the curtain around the bed, and close the door if possible or if applicable. Then next, we need to prepare all the equipment, because some meters can turn on when the test strip is inserted into the meter. Then calibrate the meter and turn control sample according to the manufacturer's recommendations or instructions. Then confirm the code number. Afterwards, some model are not required calibration, that because the technology is integrated into the test strips. And for implementation, apply gloves. Then afterwards, we need to choose the site, or we need to select the site that has no that is not bony part, or avoid the bony part of the sites, then we need to clean it with alcohol swab, then um, dry it completely. We need to dry it because the alcohol swab, if the alcohol will it has effect to the result of the test when we puncture it, if it is still wet. Then next, obtain the blood specimen. First, we need to place the injector against the site, and we need to release the needle, because permitting it to pierce the skin, make sure that the lancet is perpendicular like that. And then because the lancet is designed to pierce to the skin uh, with perpendicular position, and the needle will prick the site using darting motion. Then afterwards we need to squeeze it, but we should not touch it, because the adequate blood covers the indicator square. Then afterwards the pad will absorb the blood, and the reaction will occur. And do not smear the blood, because smearing the blood will cause an inaccurate reading. And some meters does not weak, just touching the puncture site with the strip. So we need to be careful when we are doing this. And we should ask also the patient or the client to apply pressure to the skin puncture afterwards, with 2x2 gauze, because pressure will assist homeostasis. So after darting it like that, and we need to place the strips, and we need to expose the blood to the strip to have the blood sample on it. And after some times, if the blood is already there, we can place it to the glucometer, or we need to follow the instruction by the manufacturers. or what will be doing next, because it is important to follow it so that we can have the result accurate afterwards, to avoid any mistakes, because the blood must remain in contact with the strip, uh, based on the prescribed by the uh, or prescribed by the doctor, or according to manufacturer's instruction, so that we can get the accurate result. And we need also to take note that some glucometers have the test strip placed in the machine before the specimen is obtained. So it's look like that. If the blood is already there, it shows the blood. It will measures immediately after we put it there. So we put it there according to the manufacturer's instructions, so we must just follow it. Then also to the specific recommendations for the specific procedures. Then after the designated time, the result will show automatically. It will display on the monitor based on the timing that ensures the accurate results. Then afterwards, we need to turn off the meter and discard the strip in proper receptacle, or in the what do you call that one, in the biohazard container with the 2x2 gauze. And next, discard the lancet in the sharp container. Then afterwards, we can remove the gloves and perform hand hygiene. And next, after performing hand hygiene, for evaluation, we must compare the glucometer reading with normal level values. And next, relate the blood glucose reading to previous reading, and the current condition of the client. Then afterwards, we need to report to the physicians if we observe any abnormal results, and then some blood glucose, if the capillary blood glucose exceeds the certain values. And for documentation, document the method of testing and results on the client's record. Then the client's record may include a flow sheet on which capillary blood glucose results and the amount, type, route and time of insulin administration that are recorded. Then always check if the diabetic flow sheet is being used for the client during the shift, and we need to check also the orders for sliding scale insulin based on capillary blood glucose results, and administer insulin as prescribed by the physician. So on January 5, 2021, at 9 p.m., patient Madel has received 15 units of Humulin R, that is insulin administration for her because of the result of her CBG that is prescribed by the physician, and that is recorded that has been recorded at that time. That's all. Thank you.